Hello and welcome to this episode of Weight Loss Winformation. And today is a special treat for all of the listeners because it is not often that we have the privilege of having a bariatric surgeon on the podcast. But this bariatric surgeon doesn't just do bariatric surgery. He works with GLP-1s, he works with lifestyle medicine, which is very close, near and dear to my heart. So let me introduce you to Dr. Seun, who is a resident of New Jersey and works there. Hi, Dr. Seun.
Hi, Connie. How are you?
I am honored, is how I am. I'm really excited for the listeners because as you and I were talking, um, I want to provide information that is as evidence-based and educationally sound as I can for our listeners. And so when we have the opportunity, and the doctors in this field are so very, very busy. So when I'm able to steal a little bit of your time, it is truly a gift for all of the listeners. So thank you again for making the time to do this.
Oh, very kind of you to have me
Well,
here. It's my absolute pleasure to be here. Always happy to, try to impact the public in general, people in the bariatric community, anybody that can do with some more knowledge, some more insight, to
absolutely.
better themselves and their circle of influence.
Thank you. Yeah, I agree. And knowledge is so important. And our whole field of bariatrics has changed so dramatically in the last couple of years. And you told me that you've practiced in New Jersey for a long time. Tell us how you got into this and, what you've been doing over the course of your career. And then we'll kind of move into the disease of obesity and the current treatments.
Okay. Yeah. So I got into this field. Um, I can say from when I was in residency, looking at what I was going to do for fellowship. And the interest for me was the intersection between technology,
Ah,
laparoscopic surgery to be precise,
right.
and, surgery itself. I was doing a general surgery residency, but I liked the way that technology was coming in with laparoscopy at the time. And
Right.
the place where I saw that the biggest impact could be made was actually in bariatric surgery because, no pun intended, these were big people, but we were using small incisions,
Yes.
to do big surgeries. So
Yeah.
that really piqued my interest. And, I got into that, got into a fellowship to do bariatric surgery, and the rest has been history. And that has also gotten me to where I'm interested in taking care of this obesity epidemic where we
I
find ourselves.
agree.
And I think about it now not only in terms of the tools like surgery, those interventions and medication, but also lifestyle. We also have to look at what is the cause of the problem. You're not going to come in with a mop and be mopping the floor frantically if you have a flood, if you didn't even turn off the faucet. So
Brilliant.
we
That
got to look at the causes.
that is the first time I've heard that analogy, and it's a beautiful analogy, and it really explains what's happening with this epidemic. And I'm glad you used that word because when we think epidemic, we think COVID, right? We all just went through the pandemic with the COVID thing, but obesity is an epidemic as well.
Yes, it's something that affects so many of us. I mean, two-thirds of the American population are overweight or obese.
Yeah.
5% are morbidly obese. That's over 12 million people. So, I mean, we can't possibly do surgery on all of them. We're giving it a good try to put all of them on medication, it looks like, with the
Yes, for sure.
with the GLP-1s.
Yeah.
But I think we also have to look, what is the cause of this? What is happening in our culture that is responsible for this? And what are simple things that we can do? Simple doesn't mean easy, but what are
Right.
simple things that we can do and have people adopt this and try to, remove themselves from that statistic, in a natural way.
Absolutely. And I love that too because we do have to look at what's going on. And you and I probably are so much more aware because we read about in the last 20, 30 years, the percentage of overweight and obese people in our country has gotten so much greater. So how would you explain that if you were giving a talk to an audience and they say, well, genetics haven't changed that much in these short years? What has changed?
Yeah, what has changed is our environment. What has changed is our food environment. What has changed is our environment as far as the culture in terms of moving and exercising, our stress levels, our sleep levels. Those are the things that have changed. And Connie, I don't know if you have an idea, but we're never told to what degree these different things affect us.
Right.
So what is the amount of effect in terms of diet and nutrition? What's the amount of effect in terms of the sedentary society as opposed to exercising and mobility? What is the extent of the effect of sleep? But if we were to hazard a guess, I would say what has the biggest effect is probably diet.
For sure.
You know,
And
so
yeah, and so I think a lot of people, and especially, well, I'm not going to say especially. Okay. I've been doing this for I've been doing this for so long that when I started working in the bariatric world, there were open surgeries. So there was no laparoscopic when I
mhm.
first started. That's how long I've been doing this. So over the years, I think it's been made pretty clear that exercise is not the greatest way to lose weight. But the fact is that we have to exercise to maintain that weight loss,
Oh,
correct?
of course, of course. I think the other thing too is that we always tend to think one thing is the solution. So,
Yes,
I have a weight problem, I got to exercise more or something like that, or maybe two things. But there's a whole series of things. To be successful in anything in life, you find out that, whatever endeavor it is, there are multiple things you have to do right.
that's right.
And some might have bigger impact, some might have a smaller impact, but you would take all of them together and the sum total is usually what gives you the result. So I like the fact that the American College of Lifestyle Medicine has these 6 pillars, so
And
that
those
you
are
know that these are the things that are going to help you to lose weight or maintain your weight loss and gain health.
yes,
And those, all the 6 pillars are important. Obviously the impact of each of them on weight, for instance, is different. The effect that exercise has is different. It's more protective of health
right,
than it is the a major weight loss tool. But
right.
you want that aspect as well, and you want the amount that it also contributes to weight loss. So that's what I like. It's this myriad of things. You have to try and get each one right and have the contribution of each one of those to a
Yeah.
healthier lifestyle.
I'm chuckling to myself as you say that because most people don't want exercise, right? But we know that it's critical. So most people want to lose weight. They don't want the changes that come with it. But in the program that I do, I have a list of what I refer to as the gotta do ums. Because these are things you've got to do. If you say, I want to live a healthy lifestyle at a healthier weight for my body, then there are some things you have to accept that have got to be done. So let's talk about the 6 pillars that the American Academy of Lifestyle Medicine says are, are critical when it comes to addressing the disease of obesity.
Yeah. So the 6 pillars of lifestyle medicine. Number one is nutrition.
Correct.
So you got to address healthy nutrition, and their science and their research has, shown them that that is more of a plant-based nutrition.
Hmm.
Then exercise, and movement is a second one, and then third you have sleep, good restorative sleep. Then you have stress reduction. So doing some sort of practice that helps you de-stress, things that don't help you to put on the stress in the first place actually is part of
Correct.
it. And then things that you use to de-stress.
Hmm.
And then I believe number five, you have community, social connectedness,
Mm-hmm.
right?
Yes,
Because as humans, we're social beings, and you
absolutely.
know, wellness is tied to the connections that we have, healthy relationships, and things like that, and then avoidance of risky substances. You
Right.
know,
You are a man after my own heart, let me tell you. Because all of my work is designed to address the obstacles that prevent you from following through with these things. Eating
yes.
the healthy foods, moving your body, getting enough sleep, learning to prevent stress and decompress from it, and having support and avoiding, of course, things that are going to lead you into more trouble. So I love the lifestyle medicine approach to all chronic illnesses. And interestingly enough, when I started in this community, and probably when you did as well, they hadn't even, the American Medical Association hadn't even said that obesity is a disease,
Mm.
right? Were you around before 2013? You
Oh
were.
yeah. Oh
Yeah.
yeah. I'm aware of that. I'm aware
Yeah.
of that. And when they had the AMA finally declared that obesity is a disease, and just like you have high blood pressure or diabetes and all the other chronic diseases. And it's interesting that these diseases are related,
Absolutely.
and that's one of the big elephants in the room that we do not recognize, that these are associated diseases because they have a common cause. They're environmental diseases that are linked a lot to our lifestyle,
Mm-hmm.
and especially what we eat.
Mm-hmm.
So they have a common cause. I mean, and it's like we sometimes don't learn the lessons of history. There was a gentleman that worked in uh, Africa, Dennis. What's his last name? I'm blanking on his last name, but he went as a missionary
Mm-hmm.
to Africa and worked in the rural villages. He's famous for discovering a particular tumor that comes at the angle of the jaw. But one of the other things he noticed that was in that African community,
Mm-hmm.
they weren't seeing the surge of chronic diseases that he was seeing back home in the UK.
Okay.
And he came up with this theory, and he didn't have the scientific backing then, but he said that, look, if you've seen a new group of diseases, that they tend to have a common cause.
Right.
And at the time, he felt that common cause was the lack of fiber in the European community, as they were moving from eating porridge and things like that to eating
Mhm.
breakfast cereals and more of the processed foods. And while in the African community, they were eating their traditional
Right.
African diets that were mostly plants filled with fiber. So
Exactly.
a lot of diseases that we're knowing now that are linked, he pointed out then, things like diverticulitis that was appearing in the Western culture but was
Right.
non-existent in the African society that it was. Things like even appendicitis, not to mention
Wow.
the common ones. Yes, not to mention the
Wow.
common ones that we know, the diabetes, the high cholesterol and things like that. And then certain cancers, even colon cancer. So
Absolutely.
there was a big difference. And today, we now know the cause of some of those things, why relatively in this one culture it's different from the other.
And I think it's really unethical for our professional community to ignore that. You know, people who aren't professionals, we have to educate them. But people in the bariatric community who act like it's a one circumstance kind of thing, they are missing the
Mm,
boat. This is a lifestyle disease that affects all areas of life. And so
yes.
we have to tend to all of those areas in the treatment of this chronic disease. So s- I understand that a patient who comes in without, the vast knowledge of information that we have, but now they have access to it more and more because of the internet, but they want to lose weight, right? They just want to lose weight. So it's our job to educate them about the nutrition first and foremost. And I think most bariatric programs do that, are good about that. But when it comes and exercise, we make it clear you got to be moving. But we don't educate about it's important to get this much sleep and it's important to deal with stress. And we don't teach enough of stress management and we don't teach enough of the tools for
Mhm.
that. We don't preach enough about the importance of community, not just once a month at a support group, but on a daily basis with people who understand this. So I love that you have this whole lifestyle um, thought behind the work that you do.
No, absolutely. I mean, it took me a while to get there. And I'll tell you my story, even
Yes,
as a
please.
bariatric surgeon.
Yes.
Um, it's less than 10 years now when I started to gain weight.
Really?
Myself, yeah, I was putting on some weight, but the straw that broke the camel's back was when I developed pre-diabetes. My
Okay.
A1C was 6.7. And then I was also, my blood work, which I tried to do, on a yearly basis, also came back high with cholesterol,
Really?
over 220. So I was like, wow, what do I do now? Um,
You're like, wait a minute, I'm the one teaching this.
yeah, my wife is a physician. I could imagine her getting out her prescription pad, writing me up for some statin or something. And then
Exactly.
I imagined, if this continues, then what happens when I need bariatric surgery? Who do I
Right.
go to? So this was a turning point for me, and this was when I decided to delve into looking at, what is the root cause of this problem and how do I solve. I looked at, communities. I studied like blue zones. Why don't they
Yes.
have this problem?
Yes.
You
I
know,
love the
why
Zoom
don't
blue
they have
zone
this?
stuff.
So yeah, and then everything I looked at, I saw where it was backed up with science.
Mhm.
The science that we're now discovering, and more people are looking at this. So that is when I saw that, listen, if obesity is a disease of excess, we
Yes.
can't really treat it by adding things. There are things that have come into our culture that we're used to eating that we consider to be normal,
Right.
that are providing these excess calories. And
Correct.
there's a link between these excess calories, what kind of foods there are. A calorie is not a calorie, is not a calorie. What kinds
Exactly.
of foods there are, and the chronic diseases that we see. You know, I'll give you an example.
Okay.
Foods that are high in saturated fat and cholesterol. This is the fat that goes in your bloodstream, and cholesterol also goes in there as this sticky fat, and
Mhm.
in places in your bloodstream where the vessels divide, right?
Mhm.
There's turbulence there. And then if you have excess of pro-inflammatory things in your blood as well, it makes that fat sticky, especially in those areas where the blood vessels divide.
Okay.
Because there's turbulence, there's fat that is sticky, and that can tend to accumulate over years. This is the genesis of heart disease when it happens in the heart, especially
Mhm.
in the left anterior descending vessel, which is a fancy name for the big vessel on the left side of the heart that they call the widow maker, because
Right.
it's a big division
Right.
there. And also in the neck, where the vessels go up to the brain and there's a big division. So it's another
Uh-huh.
place where there will be turbulence, and this sticky
Right.
thing will stick there and causes stroke.
Yep.
So it's the
Very.
same cause. The same thing in the lower extremity in the legs, where you have those kind of vessels, and
Mhm.
if you have those, that sort of situation can cause what do you call peripheral arterial disease. People can have claudication in their legs, especially if they have something else that causes a pro-inflammatory situation like smoking.
Right. One of those risky behaviors.
Yes, one of those risky behaviors. So these are, in medicine, we treat as three different things, because
Mhm.
we never talk about the cause. We train medical professionals, and then they pick a part of the body, and one person is a stroke specialist, one person is a heart specialist, one person is a vascular surgeon, but they're treating the same thing, the same
Yes.
cause. If
Yes.
we learned, and this is the thing that is really fascinating, if we learned to remove the cause, the body has the wherewithal to actually repair those situations.
Agree. Agree. And, I'm reading this book by Dr. Sanjay Gupta about the brain, and that relates to the same cause, right? It's what we're putting in our bodies to
Yes.
such a huge degree. And in the work that I do, and I can tell that in the work that you do, you know, I focus on, all right, what can't we change and what can we change? What
Mm,
can you influence in this process for yourself and what can't you? So you can't influence how you were raised and what you were taught to eat, but you can influence how you eat as an adult. You can't influence the fact that society has become so filled with highly processed foods, but you can influence what you choose to eat. And by learning to eat whole foods and plant based foods and things that are clearly not causing problems in other cultures.
yes.
We can influence that. You can't influence the fact that our culture is completely stress based, but you can influence whether or not you learn tools to de-stress or learn to, prevent some stress in your life. You know, um, you can't change our culture in terms of its busyness, but you can learn to carve out time for movement. So it's about taking responsibility for what you can control and saying, I'm not going to put my time and energy into the things I can't,
Yeah.
but I can do this in those pillar
Yes. This
areas.
is this is one of the things that I say. I say nobody is coming to save you,
Yes, Mel Robbins.
but but you can save yourself. And
Yes.
your body is with you. Your body is
Yes.
not broken. Your body, has the capacity to heal, to
Yeah.
rejuvenate itself, only if you would get out of the way, only if you would remove the things that are harming, that are causing the problem. The
Yes.
same way as that faucet metaphor, you can't start to treat a burned patient until you take the patient out of the fire.
Correct.
You can't
Correct.
layer on the treatment, you can't start applying the bandages and the salve and everything while the
Right.
patient is still in the flame.
Yes.
So this is what we're doing. We're trying to get all these fancy things to treat the problem while we're still essentially leaving the cause of the problem in place.
It just, I'm telling you, stirs me.
Yeah. So
Yeah.
that's what I learned to do when I figured out those things.
Yes.
And I've lived in three different cultures. I found out that, look, I come from Nigeria. The diet there was different, even though there was an influence of Western culture. We were eating some
Sure.
of the Western things, and the generation of my parents were the first ones to start developing these chronic diseases, who
Mm,
their parents in the traditional villages and they didn't
right.
have, you
Right.
know. And then I've lived in the UK.
Oh, how was that?
Well, UK is more regulated in terms of their food industry, and
Oh, good.
they have more of because everything is not based on the capital system, and they have a more socialist sort of thing. There's opportunity for the government and the um, regulators to rein in the excess practices of some of the food industry. I'll
Nice.
give you an example. I had my sister and her husband, my brother-in-law. They live in the UK.
Mhm.
They came over to ours here in New Jersey to visit, and they were gulping down this drink called Ribena. It's
Mhm.
a black currant drink, but it's made by, I think, Smith Kline Beecham. It's made in primarily in the UK.
Okay.
I was surprised why they were so taken by it here in the US. So I
Mhm.
said, guys, they make this over at your place in the UK. Why is this so special to you while
Right.
you're here? And they told me, oh, it's different. In the UK,
Let me guess.
it's not as sweet as here because they don't allow them to add as much sugar.
Exactly what I was gonna
The
guess.
same exact product.
Yeah. Yeah, that's telling.
That is very
Very
telling.
telling. Yeah,
That is very,
so you started doing research for your own health, and
yes.
you started making changes that you could influence. What did you change in your life?
Okay. So what I did was this: when I found out that there were basically two categories of foods that were the ones letting me down,
Okay.
and these were processed foods. You know,
Yep.
processed foods as opposed to real foods, anything that grows in the ground and you don't do much to between where you prepare it and eat it versus something that is being manufactured somewhere and they're adding chemicals that you can't pronounce and things like that. So I removed the processed foods from my diet.
Well
The
done.
other thing, and this is the difficult one for a lot of people, and the one that causes the most angst because it's very entrenched in our culture,
Mhm.
is animal foods. And I
Ooh,
love animal foods. I
yeah,
love the taste of it. I love the taste of chicken,
sure,
all that kind of thing. But I found out
sure.
that if this thing is going to be causing me harm, I have to go on the pill and things like that, and who knows what it might cause in
Mhm,
in the future. I would have to dramatically reduce it or eliminate it where I can. And
mhm,
I noticed that in those societies where they do not eat as much animal products and it's not what is at the center of their meals culturally,
mhm. Right.
that they do a lot better. They don't suffer with these problems. That and I found out that even in this society in America, we have a blue zone amongst the Seventh-day Adventists in Louisville.
Yes, I've read about that.
Yes.
Absolutely.
So they're in essentially the same environment, but
Yeah.
these people live 10 to 15 years longer than the average
Mhm.
Americans, and they have more centenarians than the average Americans.
Right.
So they eat according to a particular verse in the Bible, which is the
Mhm,
initial place where any kind of food was mentioned in Genesis 1:29. And
mhm.
it doesn't include animals.
Yes, I have read about that.
Yes, and they've been well studied.
Yes.
So I found that if they could be living in America, breathing the same air, uh, you
Yeah,
know, and
having the same
everything,
fast food on every corner.
yes. So that showed me there was something here. So I, based on that, minimized animal products in my diet, and I eat less than 5% animal products in my diet, and
And
I
I like
stepped up
I
the
like
plant
that
foods.
yeah, and we're gonna talk about that specifically, but I like that you're saying, because people are probably going, "Oh my god, I'm not gonna get well, how do I get enough protein?" Because in the bariatric world, it's all about the protein, and so people automatically think animal products. But you're an example of that doesn't have to be exactly the case, and so are a lot of other people. So talk about the plant-based proteins, um, and how that works.
So here's the thing. Number one, nobody is eating quote unquote protein. You eat foods.
You're so right. I love that. Well
Yeah,
done.
and part of what they contain is protein, and they would call it protein because it contains a lot of protein or majority of it is protein, that sort of thing. But the main lesson is that you got to take the holistic approach in terms of all the things that particular food contains. When we're talking about proteins, we're talking about foods that break down to amino acids. Amino acids help you to build dead dying cell, replace the cells. It helps you if you're growing, forming more tissue. It helps repair as well. So yes, you need that. But the thing is, for different types of food, there are other things that come along with that protein, along with those amino acids. And those are the things you need to look at to choose what sort of protein that you consume that will be good for you overall.
That is such a
So
good lesson. So
yeah,
yeah,
so
keep
given
going.
that plants and animals contain protein. Plants in especially the legume category, beans, lentils, chickpeas contain protein, and animals, milk, eggs, cheese, fish, chicken, turkey, bacon, everything that moves and slithers or has a face has a mama. They contain protein, right? So now, what is the difference? What does one category have that the other doesn't have, and what is the impact of that on your health? So for the animal products, along with the amino acids and the protein, you do have saturated fat.
The stuff that clogs the arteries in
This
the
is
vein.
the stuff that clogs the artery. And if you don't believe that, just take a piece of chicken, a piece of beef, boil it in water, see what floats up to the top, and at room temperature, see what happens to it, how it congeals. This is
Right.
what happens in the arteries when you consume this.
Yeah.
Um, they have cholesterol. All animals, including humans, have and produce cholesterol. When
Mhm.
you um, when you eat other animals, you're eating along with that animal product of flesh, their cholesterol as well, and that now becomes a part of your total cholesterol, and it
Mhm.
makes your body actually it makes it hard for your body to control your total cholesterol when you are sort of controlling it with what extra cholesterol you're putting in your mouth.
Mm. Mhm.
Okay. And then there are pro-inflammatory products also in the animal foods. For some reason, I mean, I've heard it explained that the flesh of animals that we eat, for them, is somehow a part of the way that they um, excrete toxic substances or
Okay.
get rid of toxic substances in their system. It gets stored in the flesh, but we know that there are pro-inflammatory substances in animal products. We know, for instance, in beef, when you do your grilling, that charred portion is
Mhm.
heterocyclic amines. We know that the some of the from chicken, some of the product gets converted in the body to what we call TMAO, which is a pro-inflammatory product. We
Wow.
know about heme iron as well, and on and on and on. So it tends to be pro-inflammatory. So that's on the animal side. Now, on the plant side, you would get those amino acids, but you will get it with fiber. Now,
Right.
fiber is what gives plants their structure, allows them to grow upright, while animals have their skeleton. But you get it with fiber on the plant side. And fiber, first of all, on a physical level, is something that helps you to prevent constipation. It gives formation to your stool so that it can move along. Your body has something to grip on. It also acts as sort of a buffer
Mhm.
to some of the foods that contain fiber, so that physically those foods don't interact with the walls of your bowels, and foods get absorbed more slowly and steadily when they contain fiber as opposed to when they do not.
Okay. Which helps with
And
blood sugar, I
which
know,
helps
right?
the blood sugar, because things get, it's if a rush of blood sugar comes in, your body has to, rapidly send in insulin.
Mhm.
And because there's excess of blood sugar, the excess will be converted into fat.
Yep.
If the sugar is coming in slow and steady, your body can use it up as you go along. So it
Yes.
doesn't have to push any excess into storage into fat. So that's a good thing. The other thing that fiber does is that allowing the food to get to the later parts of your intestine instead of all getting sucked up in the earlier parts,
Mhm.
it triggers hormones that allow you to feel satisfied. There's a hormone that I love the name. It's called the ileal brake.
Oh my gosh, I've not heard of I've just heard of
It's like
leptin
putting the
ghrelin.
brakes on your appetite or putting the brakes on
Oh, I
your feel.
love
Yeah,
that.
it's peptide YY
Okay.
called the ileal brake. So
Huh.
foods with fiber get to that distal portion of the intestine. Your body hits the brakes. You feel like you're full, you're satisfied, and you stop to eat.
Mhm.
So foods with fiber are more filling as opposed to things that just melt and dissolve in your mouth but carry so much calories. Other thing that fiber does is that when fiber now gets into the colon, Fiber is then digested by these bacteria, and
Mhm.
this then produces antioxidants.
Mm,
These are the counter to pro-inflammatory things. These
mm,
are the counter to the inflammation that goes on in your body. These are the counter to oxidative stress
okay.
that gets
Good
mentioned quite a
news.
bit. So it calms down inflammation as a result of the processes in your body. It makes you feel healthier. It makes healing easier. So it's a great thing. Your body breaks down the fiber, it forms these short chain fatty acids, and those are antioxidants in themselves. Your body also promotes the growth of the good bacteria as opposed to the bad bacteria.
Wow.
So it's benefits all round. And these things are not just effective in the gut, they enter into the bloodstream, the antioxidants, and they calm down inflammation everywhere else in the body.
And
So
so the increase of inflammatory diseases that we've seen in the last couple generations, probably also related, the core is diet.
yes, that is one pathway. If you're eating so much animal products, you're eating a more pro-inflammatory diet as opposed to an anti-inflammatory one. That is one pathway. Another pathway is through the processed foods.
Mm,
Apparently, processed foods with the tenderizers, the emulsifiers, and those such colorings that they add
right.
tend to wash away the lining of the GI tract. And with washing away the lining of the GI tract, whole proteins are able to enter through the gut. And you have the so-called leaky gut syndrome.
Mhm, mhm.
So your body is not meant to deal with those whole proteins. So your body then reacts to them and sends the T cells in, the immune system, the bodyguard of the body sends them in. And because these proteins are somehow close to some of our own natural proteins in the joints and things like that, so your body starts to attack even itself.
Oh, wow.
That's
Okay.
how you have the your body's attacking
Yeah, yeah, yeah.
autoimmune conditions.
So helpful to understand that.
Yes, and that's why you would find that those places where there's high consumption of processed foods, animal products, they have more of those autoimmune.
That makes perfect sense. Question about the fiber. And I'm sure all of the information you're sharing pertains to whether a person's on a GLP-1 or has a surgical procedure or any of that. But when you have a surgical procedure and you're messing with the intestines, how does that affect the fiber and how it works in your body? Do you still get the benefits of the fiber if you've had some of that intestine removed?
Yeah, you still get the benefits of the fiber. Um, even though you're now tinkering with how the body itself reacts, is the thing. You're making the gut shorter in some of these uh, surgical procedures. So it's like two sides of a coin. With the fiber, you're affecting the cause and you're dealing with things from the root cause.
Hmm.
With the surgery and the GLP ones, you're sort of bending the way the body works
Correct.
to adapt and produce the result you want in spite of not changing the cause, as it were. But
Hmm.
you see, if you change the cause, the amount of bending that you have to do for the body to produce the result you want would be less.
Because as you said, your body wants to work with you,
Your body wants to work with you.
but we have to work
Well,
with our body.
exactly. Yo, I like that one.
Yeah.
We have to work
Yeah.
with our body, not just trying to bend the body to work with you. Exactly.
Exactly. Yeah. So we have a responsibility in this process.
Absolutely. Absolutely, we do. Absolutely, we do. Um, so the idea is, at least in my professional life, I understand. Um, if we look at statistics and we gave people all the tools, all the knowledge, the percentage of people that would, you know, change their lifestyle and abide by what they've learned, and transform themselves is still small, not because that it doesn't work, but because they won't do it. And sometimes it's difficult because you know, if you live in a society and this is the norm and this is what everybody is doing, the tendency for you to follow suit and just go with the flow is high. Studies
Mhm.
show that the influence, what influences what you eat, to a high degree is what the person across the table from you is eating.
Wow. Yeah.
So there's a cultural issue, and until we can make that culture shift, it's difficult to have a significant proportion of people, change their lifestyle. But we're
Oh,
here for only a limited amount of time. People are dealing with these conditions. If they can get a hold of a medication, if they can get a hold of a procedure that would help them, for the period that we're here to live a longer and healthier life, I think that is acceptable. So that is where the medications come in, GLP-1s, the surgery comes in, bariatric surgery. Those still play an important role.
right.
However, I always do not, never, use that as an excuse not to pay attention to the lifestyle change.
Without a doubt.
Yeah.
Because, it's acceptable, but it's not exceptional,
Yeah.
right? So, do you remember 100 years ago there was a book called The Road Less Traveled?
Mm, I don't think I've heard about that.
Well,
Tell
it's a
me.
great book, but it's 100 years old. But what we're talking about is choosing the road less traveled in terms of choices about your own health and your own lifestyle. So we have the tools. We've got the GLP-1s, we've got the bariatric surgery, and that's going to help. But the body also, as they say, knows the score. And with bariatric procedures, right, there comes a time when the body kind of figures out a little bit and regain is a little bit easier without those lifestyle changes. It's
Absolutely.
going to be really difficult. And so all of the work that I do is geared toward let's work on changing this lifestyle. Be one of the beyond acceptable, but exceptional people in this process who is courageous enough to look at what are the obstacles that keep me engaged in the unhealthy lifestyle things and faces whatever those obstacles are so that they can work on all of those pillars, which is, and you know what, you as a human being and your own lifestyle, there's no greater example.
Well, thank you. But I agree with you wholeheartedly. And I just say amen to that. The more people at, pushing that forward, that you know, this is the path, actually, this is the most natural path.
Right.
This is actually the path that costs nothing. Just change what
Exactly.
is on your plate.
Hmm.
Change the proportion of what is on your plate. You don't even have to get rid of the animal products 100%. You just have to reduce it, get it down to less than 10%. You will see a significant impact. You
Right.
know, these are the things that people need to understand. And if they understand that, they're halfway there.
Exactly.
If you do need, I mean, because there are issues with GLP-1s, for instance, right now, there's the cost,
Right.
there's access issues, until we get over that hump. It's tough for everybody that wants it or needs it to be able to get access to it.
Right.
And even if we get there, how much of our economy, how much of the cost as a society are we going to invest in, you know, uh, GLP-1 medications?
Hmm.
Same thing with surgery. People have the fear of surgery. They don't want to go under the knife.
Hmm.
Even at best, we were in the United States, we were performing bariatric surgery on less than 1%
I
of
know.
those that qualify for it.
And that's been the same statistic since I started over 25 years
Yes,
ago.
yes, for a
Yeah,
long time.
yeah.
Even as much as the surgery has become safer and safer. So there are all these barriers. I wish there was so much more awareness
Yeah.
about the lifestyle changes that don't cost you anything.
And I think that it's our responsibility as professionals in this field to help people help themselves with the surgery and with the medications, but also ethically educate them about the need for change within their environments, within, and let me ask you a question, just out of curiosity. How much information do you get about the person's life, like trauma history or, current situations like a bad marriage or, you know, trouble in their lives? How much history do you, as the doctor,
Mm,
get?
yeah. I wish I could get more than I'm getting, but we delve into that very little. We
Yeah.
don't never go in depth into that sort of family history, their family situation, and you're right at what you're hinting at. Those things do impact, you know, um, what they're able to do, whether they live in a food desert, whether there are other social determinants that affect how they can get healthy meals and things like that. So those are important areas that we're yet as a society to pay a lot of attention to, or to put a lot of funds into, to
Right.
look into those sort of things, because the return on investment for those sort of things are not immediately apparent.
Exactly. Exactly.
However, that's the pathway that would get us to a healthier community
Absolutely.
where we reduce the cost of healthcare.
Yeah. And, I'm in the process of writing a book about um, the multidisciplinary theoretical approach to this disease and all chronic diseases. And I say theoretical because I think, you know, a lot of programs do their best. We have the pieces. We've got the dietitian, we've got the surgeon, we've got the bariatrician, we've got the exercise person, we've got the mental health person. And that is a great, great thing for our patients. And I don't expect that a dietitian should be a therapist, or a therapist should be a doctor, or a doctor be a, psychologist. But
Hmm.
the importance of all of us on the team understanding the different obstacles so that we can refer to the appropriate place, because from my perspective, the people that I work with most have emotional issues that kind of congeal in this place of, I don't feel like I'm worth it. I feel inferior. I don't feel as good as other people, which prevents them from behaving in these ways. People who don't feel good about themselves don't often treat themselves well. So, to help them feel better about themselves, to work through the self-esteem issues and the shame issues from whatever, is an important part of this that you shouldn't have to deal with, but should absolutely be encouraging people to deal with. And the dietitian, encouraging them, teaching them about the whole foods and the fiber. It's not your job to teach them about all of those things.
Hmm.
Um, but we need to work together to help our
Absolutely.
patients get all of those
Absolutely.
pieces covered. So, how do you determine which surgery is best for which person, or if they should do a medication or both? How do you decide that? I mean, there's a lot of options.
Yeah. Well, I try not to be rigid about this. And then I would tell you that in this day and age, most people will come to you saying, I
This
want
is what I
this,
want.
I
Yeah.
want that. And, before you even say, but, they're like, I've done my research, and I wonder, what did I go to school for?
Yeah. I'm sure
Everybody's
you
done
do. It's like your research is from the Instagram and Facebook.
their yeah. So they're choosing, and what I feel my role is to then guide them and say, but having looked at your medical profile, you
Yes.
know, you should consider this option versus that, option. Obviously, people who have, like, if we're talking about the obese community and they are morbidly obese, because it'll be difficult for them. I'm not saying everybody, to use lifestyle changes alone. When we look at large number of people, to get lots of them to lose weight, those that are coming forward for bariatric surgery, I would, choose for them or advise them. If it's the garden variety person, will get a gastric sleeve because it's the least invasive and effective
Right.
without changing the anatomy
Correct.
um, to any great extent. And then also, every time the lifestyle changes are being put in there, I'm saying it day night,
I love
three
that.
times a
Love
day
that.
I'm PRN, but so
Mhm.
that hopefully some of it sticks. And
Yeah.
then I reserve things like gastric bypass for revision surgery. If someone comes back after a sleeve and they regained weight, or they're dealing with
Acid
terrible
reflux.
acid reflux, that sort of thing, or they have, diabetes that is really bad, then we'll think about going to a bypass. And
Mhm.
again, emphasizing lifestyle changes to increase the chances of success. Essentially, I'm trying to give people the best chance of success so that they can spend more time living their life at a healthy way, you
Yes.
know, in
Yes,
health,
yes,
and getting
yes.
away from these chronic diseases.
Absolutely, because, life is like you said, this is a short journey,
It's a
and
short journey.
I, for one, wanna live it to the fullest the whole time.
Absolutely. You can't spend half your life just thinking about how you're gonna figure it out.
Yeah,
People that come for bariatric surgery and get it and are successful eventually always talk about, I wish I had done this 10 years ago. I mean, if
so
a
true.
decade of your life is a long time to enjoy family, to enjoy your kids, to be able to do the
Yes,
things that you really want to do, that, weight and chronic disease could keep you from doing. So, there has to be, um, you got to give people options that they can, you know, get into and actually execute, so that they can live their lives.
absolutely. Oh gosh, I just love your approach to all of this, and I'm guessing your whole team, because they've been kind of trained by you, is trained in the whole lifestyle thing too, your dietitian, all of the people in your practice.
Well, I would wish to say that everybody is fully trained and believes in it the way that I do, but that is not exactly how it is. Because, again, of the culture, you would meet with dietitians who would be, they're accepting of the knowledge and they are aware of it from a scientific basis, but they still believe that you need to give people options of things they like and that is acceptable to them.
Mm,
And so therefore, the message gets diluted to a point that
yeah.
it's not effective.
Yeah, I have that same, and to you and me, I mean, who have so much passion about this. It's like, "Oh, if we could just get people to understand, if we could get all of the professionals."
Yeah,
The
knowledge is not enough.
No, it isn't. Yeah, it is that is so true. It's just insufficient. One of my biggest pet peeves in this community, in terms of how bariatric centers are traditionally set up, is, there's big push on behavior modification, which is critical. Absolutely. It's the lifestyle changes. But in my estimation, because the majority of our population has experienced some, when you grow up as a person who's overweight or obese, you've experienced some bullying, some picking on, some self-esteem trauma, right? And just behavior modification alone has shown not to be effective over the long haul, right? That's why we have so much regain. But if
Mhm.
we can get into the core, like you're saying, let's look at the core of that part of it and help heal some of that, then people might be more capable of, believe my camera, it'll come back,
Okay.
of treating themselves according to these healthy lifestyles. So I always say behavior modification is essential, but it is insufficient
Yeah.
without the tools of stress management.
And let's bear in mind that the behavior modification, when we call it that, is not the same thing across the board. What some
I love
people
that.
are teaching patients as the behavior modification, you know, does not pass muster according to the American College of Lifestyle Medicine, standards.
Absolutely.
And
That is a
you
great
only
point.
have to go on social media and whatever, there's so many things being pushed out as this is a healthy lifestyle, this is healthy nutrition and everything. It runs the gamut.
Yes.
So there has to be a standard to start with,
Yes.
and that standard must be easy to understand.
I think, the simplification of that would be eat whole food, eat real food, right?
Eat real food, yeah, and eat mostly plants. The For instance, I'll give this example. I think Canada has done a good job with having a nutritional guideline that is quite simple and easy to understand
Mhm.
and execute. But if you have a nutritional guideline that is telling you about number of calories, that is telling you about amount grams of protein or
Yeah.
whatever, you know people still have to translate that. What does that
Right.
mean, grams of protein? you
Right.
know how should your plate look when it's 2000 calories and 15 grams of protein and 2 ounces of zinc or whatever. It gets to this
Yeah. It's very
numbers.
complicated.
Yeah. So tell people what categories, what groups of foods, how much of your plate should be fruits, vegetables, peppers and onions, mushrooms, that category. How much of your plate should be whole grains? How much of your plate should be legumes? How much of your plate should be animal protein? How much of your plate should be nuts and seeds?
Yeah.
You know, uh,
What is Canada? What are their guidelines?
So Canada has the guideline. It's more of what we call a power plate. Their
Mhm.
guideline, and they have very nice schematic, illustrations of this. Half your plate should be fruits and vegetables.
Yes, I love that.
Okay, then a quarter should be whole grains, and they'll give you examples. What are whole grains? Still called oatmeal, rolled oats, barley, um, wild rice, brown rice, whole
Mhm.
wheat pasta. And
Mhm.
then another quarter of your plate should be, they call it protein, but they said emphasize plant proteins,
Love that.
legumes, beans, lentils, chickpeas. And that is how their guideline is.
I
So
love
I
it.
add a twist to that, and I say that last quarter that is protein rich should be mostly legumes. And
I
if
was
you
gonna
want
say
it,
they're so easy to add to anything you eat.
absolutely.
A salad, a soup, a stew, a chili. They're so easy to add to everything.
Yes. I mean, I eat a salad every day. It's kind of my main meal, a big
I
bowl of
do.
salad. And the protein there is usually chickpeas. It's a legume.
Let me ask you about this. My main source of protein is actually cottage cheese, but that's probably a meat product, isn't it?
Well, it's an animal product. You get, where does cheese come from? Cheese is from it's a
Milk.
dairy, it's a milk. Yeah.
Yeah, I eat a lot of cottage cheese. That's probably my main source of protein.
I have a bit of cottage cheese because there's a beet salad that I get, and I think they put a tiny bit of cottage cheese in it.
Oh, I love beets. Yeah. And what do you think about the chia seeds and all those things, that you shake
So
on your
that
salad?
falls in the category of nuts and seeds. That's
Yeah.
healthy for you.
Yeah.
Especially the chia seeds, they have a lot of omega 3,
Yeah. I try
and
to sprinkle those on a lot of things.
yes, yes. omega-3 is a lot of micronutrients, so it's healthy for you. Nuts and seeds in general are very healthy. They have a lot of micronutrients. They also contain significant amount of protein.
Mm-hmm.
So also good in that wise. The only drawback in nuts and seeds is that
Calories.
even though they have healthy fat, it's still fat. So the quantity that you should consume should not be much.
Yeah.
And that number should be somewhere around an ounce a day or a handful of nuts and seeds a day.
Perfect. I love this. This is so awesome. So you have been great in terms of how you educate. And do you do YouTube talks or any of those things where people could get more of what you're putting out there? I will tell you something that I did recently and I loved it is I took a continuing ed because we have to get the credits, right? I took it through the lifestyle medicine and it was the nutrition and it was fascinating. I loved it.
Yeah. Yeah. Actually want to get the certification. I mean, I have the knowledge and the philosophy behind
Right.
it, and I probably need to just get the brand. But I've been getting a lot of certifications. To your question about YouTube, I was doing YouTube videos at the time, and then I went away to do other things and get an MBA and all that sort of thing.
Yeah.
Now I want to return to probably putting things out, the new format now, podcasts, and
You
seeing
you are amazing. How does a surgeon go off and get an MBA on the side?
one of those things I wanted to do.
Good for
So
you. That's
yeah,
amazing. I
yeah.
love
I
that.
think what it is that and I had this, my father is a surgeon, he's a plastic surgeon. And I remember, when I was growing up in Nigeria, there's a lot of power outages.
Oh,
And yes, and a lot of people got these generators that ran on petrol, and there was a lot of petrol accidents and burn
oh
victims.
wow.
So my father never had us get a generator like that. So we suffered through these outages. And one day I was driving with him and I asked him, I said, we got to the subject, say, why don't you let us have this? And he was like, well, you treat people in his career that you said you start out treating people one at a time. But at some point in your career, you start to care about why are you seeing these people? Why are you seeing these patients? Why are they coming to you? And whether you can deal with root causes of what's the problem. Because he was treating a lot of burn victims
Sure.
from petrol generator explosions. So therefore, he didn't let us have one at home.
Mm-hmm.
And he would, he in the later part of his career, gave lectures trying to
Love it.
solve the root cause of why those kind of problems occurred.
What a wise man and what a great lesson he passed on to you. And what I am passionate about as well is we need to treat the whole person because a chronic disease, like you mentioned at the very beginning, affects all of the things, right? The source, the nutrition, and then the other pillars affect so many other diseases that prevent us from living the lives that we want to live. And
Absolutely. And it's not just some woo woo kind of thing. The science has shown the connectivity of this. Even social
yes,
connectedness helps you to release the right hormones that affect your physical wellness.
yep, and
Oxytocin, and it affects blood
absolutely,
pressure, you know, all I mean, the body is a magnificent uh,
it
specimen,
is.
and it's
It
very
is.
complex. And a lot of things are connected that we may not think are apparent.
Mhm.
And these factors bring it all together.
So maybe we should summarize by saying, work with your body, and it'll work with you.
Absolutely. I love that one.
And as far as the social connectivity, and I created an aftercare program years ago that I called Weight or Bariatric Care for years, and that's what the social the Facebook group is still Bariatric Care, but the overall program is called Weight Loss Winformation. And it's because of that social connection. It's like that Mel Robbins, nobody's coming, right? Nobody's coming to do this for you. And so I tell people, nobody can do this for you, but you can't do it alone. We
Hmm.
need that social connection, and we need the social connection with
Support.
people who understand what we're doing, understand the journey that you're in, and can help you along that way. So you and I are going to talk more about that program because I want to invite all the people in the world to try it for free. So I will post in the show notes the link for a free trial of this, but I want you to share it with all of your patients, as well as this podcast, because this is episode 200 and I don't know 68 or something. I've been doing this for several years.
Well
So
done.
thank you. And it's kind of my passion project, right? I don't have sponsors. I don't want sponsors. I don't want to monetize it. I just want people to learn and share it with other people. That's how
Absolutely.
that's
That
how
is
it's going
good.
to get better, right?
That is good. We need all the different voices that we
Yes.
can get,
Yes.
different nuances from different angles, different people that different people can relate to. And it all helps.
Yes. And before we sign off, I just want to thank you for responding to me on LinkedIn and showing interest in the topics of concern for the patients before, during, and after before they start taking a medicine or before they have bariatric surgery and long afterward, because this is a lifelong journey.
Yes, it is.
Thank you so much. And I will
Pleasure.
post all of your information in the show notes. So, maybe people will be reaching out for you and saying, hey, would you do some more of those Facebook or those YouTube videos? I love your
Absolutely.
message. Love your message. Thank you so much for joining
Thank
us.
you, Connie. I
All right.
appreciate it.
I'll send you the info so you can let all your patients hear you on the episode. Okay.
Okay,
All right. Thank
fantastic.
you. All
Thanks
right.
a lot. Take
You
care now.
too. Bye bye.
Bye.